As Joe and Willie mentioned, Georgia Governor Brian Kemp will allow some non-essential businesses to begin reopening this Friday with limitations. Gyms, tattoo parlors, bowling alleys, salons and barbershops can reopen as long as they follow social distancing guidelines. You need to explain to me how you can social distance in a lot of these places because people come very close to you. They'll screen their employees for signs of a fever or respiratory illness, but they won't be able to test them. Theaters and dine-in restaurants will be allowed to resume activity on Monday.
By taking this measured action, we will get Georgians back to work safely without undermining the progress that we all have made in this battle against COVID-19. Now, I will say that, you know, when we have more people moving around, we're probably going to see our cases continue to go up. But we're a lot better prepared for that now than we were over a month ago. I can tell you, I don't give a damn about politics right now.
Yeah,
whatever.
Like, yeah.
I'm a Georgia native.
What do you give a damn about?
I'm a Georgia native, by the way, and I just watching that.
I'm scared.
Well, actually, doesn't fill me with immense pride. I think that's the same spot that same governor sat and said, well, nobody ever told us this could be spread asymptomatically.
Yeah.
Really? No, actually, everybody told you it could be spread asymptomatically. Everybody. And by the way, just for the yahoos out there, whether you're from the north, the south, the east, or the west, it's going, hell yeah, he's reopening the government. Hey, guess what? He's going against Donald Trump's own guidelines, right? So I don't know. Is he liberating Georgia from the iron grip of Trumpism? Because Donald Trump and all of his health officials over the past several days have been saying you need to meet certain guidelines before you open up. And this, I want to go to, I know we have a lot more to read, but I want to go to Jim Vandehei really quickly.
Yeah, we have
because
Jim and Reverend Al Sharpton.
And Reverend Al, because Jim, I heard you talking a little bit about this before, talking about your concern about people's safety because of partisan politics. They're like, listen, I don't give a damn whether somebody's a Republican or a Democrat or an independent. I want them to be safe. I want their children to be safe. I want their parents and grandparents to be safe. But some people are making some really stupid decisions just based on what side of the aisle they're on in the middle of a pandemic where deaths are still spiking. We're at 42, 43,000 now. We'll be at 50,000 dead by the end of the week. And you got a governor that's opening up tattoo parlors and massage parlors and gyms. I mean, I understand state parks where people can walk and there's ventilation. I understand even beaches in Florida, as long as people walk 6 feet apart, because there's ventilation and a huge breeze blowing. I do not understand these petri dishes of pandemic spread being opened.
I think Mika mentioned it earlier that Meacham called it a partisan pandemic. The truth is, there's something broken in our country in that we truly live in two parallel universes, and this is always going to be the inevitable outcome. Like in the beginning, I think most people were looking at it through the lens of what's best for my family, what's best for my community, and then now it's into the partisan phase where you had last night the President of the United States on Twitter saying that we're going to lock down all immigration, including green cards, and Republicans are going to rally around that. You have southern states saying, the hell with it, we're going to open up for business, and that other Republicans are going to follow suit. And the truth is, if you're your average Republican, you just live in a different world right now in that you are living in a state that likely has fewer cases, and you're consuming a lot of content that's deeply skeptical about the threat of the coronavirus. Where if you're a Democrat, you're much more likely to live in a big city. You're much more likely to probably know someone who's sick or dying from the coronavirus. You're watching coverage that has a much more ominous tone about it. And every single thing that's happened in the last last decade, even when it's a tragic thing that should unite people, it almost instantaneously, largely because of our consumption habits and largely because of our sort of political instincts, instantly becomes red versus blue, which if you step back, it's so asinine in a moment like this, because all that really matters is the science, your family, and what decisions should you make. So I totally get the instinct of a Southern governor or any mayor wanting to get your community back to work. And if you have the testing that you guys keep talking about, if you have the capacity at your hospitals to deal with a flare-up, if you have a sound plan for being able to deal with social distancing in these businesses that you're reopening, then yeah, maybe you can do it. And you can do it in a phased way. What I worry about is what you talked about, the testing. I'll talk about it personally for a second. Like my co-founder had the coronavirus early on. I got tested, and because I had some symptoms. It took 11 days before I got the results. Then I get the results. Thankfully, they're negative, and the doctor says, by the way, there's a 30% chance that it's inaccurate. I have a family member last night who has to go to the hospital in Wisconsin with who's in a high risk category, goes into the emergency room. They won't even test you for the coronavirus. They won't even test you for the flu, because you need to use the same swab that they're using for the flu to use for the coronavirus testing. So the idea that localities are ready for this, it doesn't match the facts on the ground, and that's where these mixed messages that the president of the administration sends, it hurts, because you need to have like this to be based on science, then make sane decisions so that you can get back to work in a reasonable amount of time.
Well, I mean, it is crazy, you know, Willie. You've got people that heard all through January and February, that this was a hoax. Like the degree of the pandemic was a hoax pushed by doctors and the media. And you have talk radio people saying it's nothing more than the flu. And then, of course, that changed when people started dying left and right. But now that actually social distancing has seemed to start to bend the curve, you once again have, cable radio or cable TV hosts, talk radio people saying, oh, it's nothing to do with anything. And we saw the TV doctors get on talking about people have to die. You know, it happens. People have to die. Stephen Moore, you know, let him die. He doesn't say it that way, but really read through it. You know, we got to get the economy open, and those people that are going out there and doing everything the doctors are telling them not to do, he called them the Rosa Parks of this generation. And it's just, I worry for them. But I'll be honest with you, like Jim, I worry for my own family, and I worry for loved ones, because we have a couple of really high-risk people living with us and around us. And I don't, you know, I'm getting notices that like baseball season may be started up soon by people who obviously are not listening to what doctors are saying. And it's crazy. Like, don't get your information from talk radio. Don't get your information from cable news hosts. Get your information from doctors, from scientists, from the people who know best. But my God, Willie, talk about the death of expertise leading to the death of over 40,000 Americans. I mean, that's where we are right now. Dangerous, really dangerous.
Yeah, and Governor Kemp in Georgia yesterday, we just heard that clip, was sort of defiant. He said, I don't give a damn about politics right now. We don't give a damn about politics right now. Care about the public health of your state and the health of vulnerable people in the state of Georgia and across the country. And if you look at expertise, if you asked, I talked to a leading doctor at Harvard 2 days ago who said, here's what this will look like if, he was talking about Michigan because of all the Liberate and the protests there. He said, for a couple of weeks, it'll look fine. And they'll say, okay, see, we were right about this. And then what will happen is the cases will explode again. And the hospitals will be full again. And we'll be right back where we started. So it may look okay for a couple of weeks, but you have to look down the road. And I think Dr. Fauci and Dr. Birx would tell you exactly the same thing. One other point about Georgia, as we talk about using data and science, you'd like to believe that this was a coordinated effort where the governor talked to everybody in hot spots, in vulnerable places. We learned at NBC News last night that the mayor of Albany, Georgia, in South Georgia, very, very hard-hit city, had no idea about this. He heard about it on TV. He had, his aide was watching television and came in and said, Mr. Mayor, they're opening up the state. To which the mayor said, whoa, 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 we're not ready for that. They had a couple of funerals that led to big problems in the city of Albany, and they've had a terrible outbreak down there. So, Reverend Sharpton, I would just ask you, we've talked about Georgia. You could look at Tennessee is another state, South Carolina, a lot of these SEC East states, if you want to put it that way. Talking about opening for business, the state of Tennessee says by May 1st, the governor there will completely lift the stay-at-home order there.
Yeah, we have members of National Action Network in Albany that was just as outraged or more as the mayor there. The real question that I raise is, what did the governor of Georgia or Tennessee or any of these states that are announcing the reopening, what do they know now that they did not know when they closed the states? The facts have not changed. In fact, we're getting the situation intensified in terms of the need for testing and in terms of the escalating amount of deaths. They are literally playing politics with the lives of their citizens, and it's atrocious. And then we have these, in some cases, orchestrated demonstrations that are coming out saying that we're against the stay-home edict with no basis at all, other than to say, I want the right to flirt with dying. I mean, this is an absolute absurdity on its face. And when we look at, as Jim say, that we're so divided as a country, where we're not divided is with the pandemic. This virus does not check off boxes, whether you're Republican, Democrat, black, white, rich or poor. This virus is an all demographic kind of disaster. And whether or not we're going to choose to live together, we will die together unless we solve this and stay home until we find out how we deal with this. This is not about which side you're on. This is about all of us trying to stay above ground.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.